double themes here.
Well, there's a baby in the episode or in the segment. Yeah, Alexandra's here. And here with some important tips on how to care for her teeth and all of our children's little teeth is Dr. Joe Willardsen. Welcome. Nice to have you with us.
Thank you.
So let's jump right in and talk about some of the most important things that we need to know when it comes to our children's teeth from this age on.
Right. I think one of the biggest things that parents need to be aware of is oral development, how that mouth is forming. Hygiene is pretty obvious. You know, you got to keep everything clean, but there's specific things that you really need to look out for with the baby as their mouth is developing. You know, if they have any allergies or if they're mouth breathers, that arch form is going to be affected as they're developing when they're young.
Sure.
Now, what about things like pacifiers and bottles and things?
Yeah, exactly. You know, normal pacifiers are kind of round. Like this is a Nook pacifier that actually is what's considered an orthodontic pacifier. So it's actually helping develop the arch so the teeth will come in straight.
Oh, so it's actually good.
Yeah,
It's
absolutely.
good.
Yeah.
That's good.
But you know what? My kids walked around with those sippy cups.
Yeah.
Yeah, and that's the thing. As a matter of fact, Nook actually makes a 360-degree sippy cup, so you can actually get them off the sippy cup. Kind of a good transition from the bottle.
Oh, we have those.
Oh, yeah, I have those. They're great.
Yeah. Those are great because they don't spill.
Yeah.
You actually have to like pull out the liquid.
Yeah, and so you're
Those are
not
great.
worrying about that one spout kind of flaring the teeth out or spending too much time with it.
All right, so you have concerns or your thoughts with...
Well, I do. I want her to have really healthy habits when it comes to oral hygiene. So I got her this little, I don't know if I've done the right thing, but you're the doctor, so you're going to tell. I got her this little toothbrush, this banana toothbrush. So for her, it's fun. And every morning and night, I'll say, brush your teeth. You want to brush ya? You know? Mommy's going to look, brush ya. She usually wants to brush ya. So... But she's not really brushing. She's just eating the toothpaste.
Right.
You know what I mean?
Yeah.
Right.
Yeah, exactly. And so it's important up until she's about 7 or 8 that you're really kind of responsible for that. So if she gets a cavity, it's really like you're getting a cavity.
Oh boy, so I need to brush her.
You got to brush her. But it's things like this that are perfect. It kind of gets them motivated.
Were you perfect?
No, I wasn't. I had terrible teeth when I was a kid.
What about your kids? Like what?
Yeah, so I have a 2-year-old and a 4-year-old. And I would say the one thing that I noticed is how tired I am to help take care of their teeth. You know, at the end of the day,
Aren't they adorable?
I'm really responsible for them keeping everything clean. So, you know, we go through our little routines. And I have to tell my son, if you don't brush, there's going to be bugs in there.
She's brushing.
Perfect.
She's a brushing.
Yeah.
See, she
wants a
wants
big kid.
toothpaste.
Yeah. She's so smart.
Which also brings me to the question about fluoride versus toothpaste with no fluoride, because there's a big debate. Do you do it? Do you not do it?
You know, personally, for my kids, I don't use the fluoride. But there's a lot of research out there, and I think that it's important that you do your own research and form your own opinions. I just don't want my baby swallowing it, and that's my personal opinion.
Sure.
Because that just changed. Because like 2 years ago, they recommended that you don't use it, and then the recommendation just changed.
And said do use it
Do
because
use it.
makes
But
them
my
not have
kids,
cavities.
all
I
of
don't
them,
know.
the twin Cocoa brush is popular, but the twins, they could chew on it and they can swallow it.
Yeah, and there's a lot of organic or holistic alternatives now. So it's, you know, it's great. And really the mechanism of keeping that plaque off is really what's very important.
My boys, go ahead.
Well, just back on the fluoride. So let's say if you're using the non-fluoride kids' toothpaste, then should you just make sure you're drinking regular tap water, which is fluorinated, versus bottled water, so they at least get some fluoridation, if that's a word?
Right.
Right, you know, and it really depends on the area that you're in, whether it's going to be fluoridated or not.
Right.
I think the most important thing is that you're just having them drink water and keep that acidity down in their mouth.
And the bacteria.
And the bacteria, yeah, exactly.
With the bacteria, I have a question. So I was at a hygienist. Is that how you say it here? Hygienist. And she said to me that it's the bacteria in the mouth that causes the cavities, not necessarily sugar for kids. And she went on to say that because of that, she doesn't let kids or discourages them from sharing because cups and things and utensils because the bacteria. I've never heard that.
Well, I know with my daughter, she steals my son's pacifier bottles all the time. We never get away from that. It's really, yes, the bacteria is eating off of the sugar, but there's good bacteria in your mouth and there's bad bacteria.
Just like there is in your gut.
Just like there is in your gut. And so it's not so much the sharing as it is just keeping it clean.
Right.
So let me jump in because both my boys have braces. And it's just hard enough to get them to pick up their wet towels off the floor, let alone brush twice a day.
Yeah.
How critical is it now while they have braces that they really have great oral hygiene?
Right now in the braces, it's probably the most important time because all of that food is collecting in the braces, and it's that starchy, sugary food where that bacteria lives, and it's creating problems. The other thing about it is with the braces, you'll notice the gums can get really inflamed, and that becomes a big problem later on too.
They just had a thing put on, a sealant. That we spoke a little bit about, and some people didn't know about this, but share with
Right. So if the tooth has a lot of grooves, or in the back teeth where the food really kind of packs in the teeth, you can put a sealant over the tooth that will kind of prevent that food from packing in there.
Right. Does it prevent cavities?
I got that when I was.
You had the sealant?
Yeah, I had sealant. I have 0 cavities.
Yeah, so it does. Yeah.
I have 0 cavities.
But does it also have to do with just genetics? Because I have to say, I brushed my teeth endlessly as a child. My teeth were always straight, but I had cavities.
I had cavities.
Yeah.
You know what? It is. You can't beat yourself up too much of it, because I have some patients who will come in and say, I brush my teeth every day, and my husband never brushes, and he has no cavities, and I do.
Exactly.
Yeah.
So it's the acidity, it's the genetics, it's all of those things.
Well, you might as well get them
Get rid
started.
of toothpaste
Well, they have gone to Princeton and have no cavities, but they're still not perfect.
Wedding registry. Wedding.
Go to truedentistry.com. You get more information about raising those little ones with bright, shiny
Pearly white.
pearly whites is what I'm. We're gonna come find Sandy Newton.
Yay!
Hey guys, we've got something to brushy. Come on back for holiday steals, because Hollywood Steals has got some fabulous ideas to keep your summer sizzling and brushy.